Alabama is at the bottom of a new list that grades states on maternal and infant health care.
Our state earned a failing grade in the new report from the nonprofit March of Dimes.
And that means many newborns and their mothers are not getting the care and attention they need. WSFA 12 News reporter Nairemi takes a closer look at the report.
In Alabama, that first cry doesn't always promise a healthy start. A new March of Dimes report gives our state an F for its number of preterm births. The report says more than 7,300 babies arrived too soon last year. And for Black mothers, the risk is even higher. Their babies are 1.6 times more likely to die before their first birthday.
The data shows deep racial disparities. Why do you think are Black moms facing worse outcomes?
Those are rooted in historical racism and discrimination. And so even when you look at insurance status and access to care and income and education, and you take all those things into account, women of color still do worse.
Dr. Warren says expanding Medicaid is an important place to start.
And that's where the medical story becomes a political one. The debate over Medicaid expansion has lasted more than a decade. 41 states have expanded it. Alabama is just 1 out of 10 that hasn't.
We find ways to pay for all sorts of things. There is nothing more important than healthcare and people's health.
If Alabama adopted Medicaid expansion, it would close the coverage gap for adults who cannot afford private insurance, but also don't qualify for Medicaid. Ensler says the federal government would initially cover 90% of the cost, and the states would pay the rest.
That would mean hospitals can stay open. That would mean that nurses and doctors and administrators and janitors are employed.
But Governor Kay Ivey's position has not changed. Her office says her concern remains how to pay for Medicaid expansion long term. Nairemi, WSFA 12 News, Montgomery.
Nationally, the United States earned a D on this year's report, showing the challenges Alabama faces mirror concerns across the country. You can read the full report on our website.